Welcome to Vision to Venture. I'm Eddie, and I'm here to uncover the realities of scaling and building a tech startup. Each week, I speak to leaders within the tech space with their insights and advice on how to found, fund, and frame a tech startup. So make sure to follow and subscribe to never miss an episode. Hello, and welcome to another episode of Vision to Venture. Today, we're excited to introduce José Alcalá, lead data scientist at Orbit Health. Jose is at the forefront of developing AI-driven solutions for chronic disease management. Join us as we explore his unique path from academia to industry, his groundbreaking work in healthcare technology, and his insights on the power of machine learning. Hello, Jose. How are you doing today?
Hi, I'm doing great. Thank you very much for inviting me. So I'm
Absolutely.
thrilled to be here. I'm thrilled to be here on this adventure and having the opportunity to share my experience. So yeah, thank you very much.
It's a
Hmm.
pleasure to have you. So to begin with, I want to start at the beginning of your journey. So what inspired you to pursue a career in telecommunications and electronics? And how did that lead you to machine learning?
Right. So, well, to be honest, that was a very big and scary leap in my life because at that time I was 18 years old and didn't really have a concrete plan or vision for my future. I just knew that I love math. I was good at physics. So I thought that initially I will study physics. That was my initial plan. But then over the summer, I got to know this new program, which is called telecommunications. It combines physics, math, and also programming with hardware design. It really resonated with me. So I decided to switch. I'm glad I did. Then, so after that, so I did my degree and I kept looking for opportunities for work, but I couldn't find anything that really likes me because everything was like a very, pure programming for creating software for big companies. So I didn't feel like I'm very motivated for that. I decided then to keep studying. I did my master in electronics, eventually land in a PhD in a
Mhm.
machine learning. So yeah, for me, I think it was more like a step-by-step journey where you build the next step to with the previous one, right? So until you find something
Yeah.
to fulfill you.
Amazing. Yeah. I mean, I guess it's just one of those things where eventually you figure it out down the road that this is your interest, isn't it? So you have a PhD focusing on sustainable healthcare models using smart meter data. How has that shaped your perspective on the intersection of technology and healthcare?
Right, that's a great question. So I realized early on in my career that there is a big gap between technology and healthcare. So, because there are many technologies that we are not using today on the healthcare, my PhD inspired me to help to close this gap. So I decided to join startups and do applied research to try to innovate, include the technology on the healthcare. In this way, one huge opportunity lies on the early intervention for age-related disease, like dementia or Alzheimer. This early intervention needs continuous health monitoring. But unfortunately, today, we are still using the traditional resources in a hospital. We can't scale the system for everyone in needs. So also the irony is that today we have affordable compact sensors that are able to track the health metrics. Um, I don't know. It makes me wonder why not using this sensor in the hospital. And that's why I did my PhD based on creating a sustainable healthcare model where we use smart meter data because that one is present in everyone's house and is transparent to the patients. Also, we can extract very interesting pattern from the smart meter data. So using machine learning, we can know when they're using the washing machine, when they're using the microwave,
Mhm.
any appliance they're using in the house, and we can extract the routine of the people. So a very easy way of doing continuous monitoring is looking at the appliance in the house, For instance, if we see like a microwave is turning out late at night, it might means that they are having some, it might be a signal of sundowning. And this is a dementia symptom where people get more confused during evening because they think it's early in the morning. So I think this is very important to detect these symptoms very early in in the life of the peoples, and this is kind of not invasive, affordable monitoring that can really transform early intervention in healthcare.
So at Orbit Health, you're creating AI solutions for chronic disease management. Can you explain what like specific machine learning techniques you're using and how would they contribute to early intervention and like personalized care for patients?
Yes, of course. Without getting into much technical details, I would say that we are using mostly time series data because we are using the data from the smartwatches.
Uh-huh.
So we're avoiding using audio video because otherwise we will make things impractical. And also we have the data privacy issues. So technically, we use to detect short-term patterns, we use convolutional neural networks. If we want to infer more long-term patterns over time, we including some attention mechanisms and also deletions. But the important thing is how we train the algorithms. So to take an example, I can talk about Neptune, which is our product for Parkinson. Here we are monitoring the motor state symptoms from people with Parkinson. As a background, so people with Parkinson might have two major motor state symptoms. One is bradykinesia, where they are all under-medicated. In this case, they have a slow movement, they have rigidity, stiffness. Um, our model will predict this as a -4 in a scale between -4 and 4. So it will spread -4 as a very severe bradykinesia. The opposite is dyskinesia. So in this case, they are over-medicated. They cannot control the movement. So they have unmonitored movement, very rapid movement that actually alter the day-to-day life. So in this case, our model is giving you between -4 and 4. That way we can track the symptoms over the days, months. And this is super useful for doctor, also for the patients, because they can know how often the symptoms are being showing up, if they are more severe in the morning or yeah, or in the afternoon. So this also helps to, optimize the medication schedule and reduce the symptoms. So it's about helping the patients to manage their day-to-day life better.
That's really cool, actually, and obviously it's good to make like to for a patient to know that sort of thing has been set up just to put like I guess it's for their peace of mind and just like ease their mind as well, doesn't it? So you have an AI solution which helps Parkinson's disease patients. Could you just walk us through the inception of the Neptune project and what inspired its development?
Sure. Well, we have been talking about the technical part of the Neptune, but what really inspired development of this algorithm is that Parkinson is the fastest growing neurodegenerative disease. It's affecting 10 million people all over the world. This number is going to be double in 15 years. So at this moment, it doesn't have any cure. Symptoms are really, really difficult to treat because it really changes from one day to the other. So right
Yeah.
now, patients typically they see the doctor every 6 months for a 15-minute checkups, which for me looks crazy because doctor needs to, plan all the medication schedule for the next 6 months, 6 months until they see the patient again. So I think this is not enough to optimize the treatment. So our goal with Neptune is to give continuous monitoring for doctors, but also for the patients, where we can see the daily routine and we can see the symptoms, and that way they can, optimize the schedule based on how they feel that day, and also optimize activity plans, so we can improve the quality of life. Yeah. Same way, I think we can also relieve some burden on the healthcare system because allowing patients to, self-manage between appointments, I think it's very important as well.
Yeah, yeah. It sounds like it's like going to be really helpful for Parkinson's patients, especially like you say, it's like there's just no knowing, is there? It's so it like spurs of it can just come on all of a sudden, which is awful. But it sounds like this could be like really, really helpful for those types of patients. So working with healthcare professionals, I would assume obviously most would not know the in-depth details of the models you develop. And as explainable AI is becoming increasingly important, um, especially in healthcare, how do you ensure that the machine learning models you develop are transparent and like interpretable for these healthcare professionals?
Yeah, you're absolutely right. So explainable AI is becoming more important, especially in healthcare.
Mm,
So we prefer to have a more practical approach. So we approach the problem of explaining in three steps. First, we need to build the trust between patients and professionals. Then the second step is provide insights, and the last step is supporting actions. So about the first step, so we conduct clinical validations where healthcare professional can check our models and see how accurate are the models. So we can build this trust on clinical validations, and then we can publish the findings so we can reinforce this trust. Also, we need to pass very strict medical device regulation because we have a medical device, and this is also give us trust on our solution. So the second part, insights, we just don't show numbers. We show everything is visual. So we show metrics in a familiar way where the healthcare provider and also the patients can easily interpret. Uh,
hmm.
they can know what's going on. And the last step with it, I think is the most important is now you can trust our solution. Uh, you can interpret the graph and you know what's going on. But what
Okay.
do I do with this information, right? What is the next step? What can I do? So for that, we also have experts that will engage with the patients, will check the data and the app, and they will plan different exercise and activity, and also they will change the medication schedule so they can improve, minimize the symptoms for Parkinson, and they can have a better life on that sense. Um, the other thing is the app. So they can plan their exercise and then they can check on the app how they are improving the motor symptoms because after the adjustment, they will have less symptoms. Yeah, that's basically it.
So it just basically keeps track of everything, and which I guess, yeah, would obviously be really helpful, especially with the amount of things that they'd have to go through, won't they? It sounds incredible, to me, to be honest with you, I'll say. Collaboration. So collaboration is obviously key in multidisciplinary teams. How do you work with healthcare providers, engineers, and other stakeholders to align your machine learning projects with the real world medical needs?
Right. So collaboration is crucial here as well.
Oh yeah.
We work closely with a healthcare provider to make sure that our model address real
Hmm.
clinical needs and not only predicting things that they don't need. We also engage, so we also have our patient engagement specialist who bring the feedback from directly from the patients. So we know how to, provide all the information more in a user-friendly environment. Then there is also communication within the technical team because, of course, all these models are being developed in a closed data set that has been clinical validated. But then we
Okay.
need to move them to productions, right? Here, in production, the data, the real user data, sometimes are a little bit messy, sometimes there are gaps. So we need to make sure that our model is robust enough so it will work on some real scenarios.
So sustainability in healthcare technology is a growing concern. How does your PhD research on sustainable healthcare models influence the development of AI solutions at Orbit Health?
Actually, there are a lot of connections between my PhD research and what I'm
Hmm.
doing in Orbit. I mean, in both projects, I'm using time series data. And so I'm able to apply many of the machine learning techniques I already knew on this new job. The other connection is sustainable healthcare because Neptune is also built up on this concept. So
Hmm.
we aim to keep things manageable, like using less data, like using only a smartwatch. And this approach also mirrors my early work, where I was using smart metadata to infer routines from people with needs.
It is very important, isn't it? When it comes to sustainability, and it's nice to know that obviously it's one of the key factors that you guys would think about as well. It sounds like Neptune is more than just going to be helping with Parkinson's, isn't it? It sounds like an incredible app. And what you guys are doing, it's really quite impressive, actually. If you ask me. Um, so Jose, you're passionate about transferring knowledge from academia to industry, right? Um, how do you balance these two worlds? Like, what skills have you found most transferable between them?
Right. So I think, on my experience, I think having experience both academia and industry is very important to be success in machine learning on a machine learning role. I'll give you a few examples. So from academia, I really learned the values of, having a rigorous research approach because training deep learning model is mostly about trial and errors. Uh,
Hmm.
if you have the a strong mathematical background and also the analytical thinking, this helps you to interpret the experiments and make improvement. Otherwise, it's very difficult. You will doing trial and error all the time. Academia also foster the habit of continuous learning, and this is also very important, machine learning, because it's a very, it's a field that evolves very quickly. And then there is also communication. So often in academia, you need to present complex idea to your peers, and that ability to extract the essence from complex concepts and explain them in simple terms, often using analogies, that is a very, very powerful tool for industry because you have people from many different backgrounds. So you need to make understand those complex concepts to them as well. From industry, I would say that I really gain a real appreciation for the practical impact and time management because I think I find limiting in the academia is publications because
Okay.
you often work with clean and curated data sets and you always aim for a small improvement on the papers so you can go to a conference and present your work. But in the real world, this is different because data is messy and it's unpredictable. I think it's more important for the model to be robust more than like being very, very accurate. And then also for industry, deadlines are much tighter. So you learn to prioritize the different tasks and get things done.
Hmm. From being in both, like obviously you've been in academia, you've been in like, and then obviously you've been in industry. Have you got a preference, or is it just like they're both so totally different you can't sort of pick?
I like both worlds actually. I like
Yeah.
when they mix. I don't like when they get extremes, right? So when you get very, very focused on industry and very focused on research, I really like
Of
when
course.
things like get tangled together and you can get the most of them because I think it's important. So we can produce new professionals from the academia, but they need to have the opportunity to work on the real world scenarios, right?
Mhm. Yeah. And I guess like you can't have one without the other, right? Because obviously when you're in academia, you're going to be doing all the research, which is then, I guess, applied and used in
Yeah.
industry, right? That's sort of where it all stems from. It's like they just sort of go hand in hand, don't they?
There's so much pressure in academia to make
Yeah.
progress, and the other way around as well in industry to make I don't know, new products. So they are
Yeah.
so focused
Yeah.
in their own targets, to get together.
And I guess that's where a lot of like the products out there, like in machine learning, sort of come from, don't they? They're like sort of, I feel like a lot of people start off in academia and then think of something, and then they'll start a business out of it, and it all does stem from being in academia and doing that side of stuff and doing all the research and learning new things. It's all a learning curve, isn't it? And it's like sometimes it's a bit of trial and error until you get something that's working and something that actually is gonna like a model or a product that's gonna either change the world or just do what it's supposed to do in general. Sounds like Orbit has managed to do that as well with Neptune. It sounds like a really like an act like a life-changing application and product, something that's actually like can do some good in the world, especially in healthcare, especially with obviously how serious Parkinson's disease is. Um, so it is really interesting to hear about how it works and how it's sort of come about. Um, and so lastly, just to wrap up this episode of Vision to Venture, Jose, you've held various leadership roles throughout your career, right? What have you learned about leading data science teams, and what qualities do you think are essential for a successful leader in tech?
Right. So I think I believe to be a good leader, you need to be a facilitator. So someone who empowers the team members to grow, take ownership, and also build confidence. So mostly my focus is being a mentor, share knowledge, so that I can also delegate the tasks and they can also get more responsibility inside the company. I think that's important. On the other side, because also the tech world, it changes so rapidly. I think it's crucial to lead by example. So you shouldn't quit coding and learning new things. So you should motivate your team by example. And it's also important to be humble because it will be very likely that somebody in your team will have more deeper expertise in their areas. So
Hmm.
important to recognize that, embrace that, and learn from each other. That's why I think is making the team strong and also collaborative.
I agree. Yeah, I think that's it's a very good point actually. And yeah, I think it's a really nice point to end on as well. So thank you for that, Jose. And thank you for explaining Neptune to me. It's been really quite like incredible hearing about what it does and how it is going to help the lives of people that do have to that people that live with Parkinson's and and how it can help. And I think it's really nice to see that people are people like yourself are using things like machine learning and AI to create these things that could change the world ultimately and help all these people. So yeah, thank you for your time. And it's been an absolute pleasure having you on Vision to Venture. And I wish you and everybody at Orbit Health the absolute best of luck for whatever the future holds. And it'll be exciting to see how you're going to be changing the lives of people that live with Parkinson's.
That's great, Eddie. Thank you very much for having me. And I hope our discussions today set some light of how AI can actually be used for improving healthcare on the healthcare sector.
Thank you for tuning in to this week's episode of Vision to Venture. If you're listening, make sure to give us a 5-star review. And if you're watching, like and subscribe to listen to more inspiring stories from leaders in the tech space.